mental health and psychosocial well-being. But there are avenues for global accountability, cooperation and positive forces, including those led by children and youth themselves. And they exist, and if leveraged effectively, can protect and benefit all children. Next slide, please. A little bit more in the background. So UNICEF each year carries out a huge piece of research named The State of the World's Children. And in 2021, we reported on mental health and well-being, undertaking a cost analysis of what looks at the economic impact of childhood mental health problems. In the report, we sought to answer the question, what is the cost of inaction? And we found that the annual loss in human capital arising from mental health conditions in children aged between 9 to 19 is in US dollars 387.2 billion. Of this, 340.2 billion US dollars reflects mental disorders, from anxiety disorders to behavioral disorders and depression. Sorry, dear colleagues. But this significant economic return only scratches the surface of the myriad of meaningful health, social, and economic benefits of such investment. And it only begins to illustrate the full impact that investment has on individuals' lives, their communities, their businesses, and local economies, and society at large. While in conversations around investment, we are conditioned to think about returns in terms of monetary value and how these investments will prove beneficial in the long term. But we must not forget the returns on the individual if we invest in mental health, which will be invaluable. We must always place the individual at the forefront of the conversation and our calls to action, and speak to the benefits for our children, their caregivers, families, communities, and yes, economies. Next slide, please. So, what is UNICEF's approach to mental health? Next slide, please, Papa. Thank you so much. Or maybe it's slow on my end. Thank you. UNICEF supports mental health as a holistic life course approach, meaning we look at from birth onwards, and it's an issue relevant to every sector, meaning we aim to be collaborative and multi-sectorial, spanning across departments in health, social welfare, child protection, education, gender, nutrition, etc. To truly be effective in addressing global mental health problems, we must be multi-sectorial. UNICEF's view that mental health exists on a continuum. So where we sit on that continuum may change over the course of your life. And so we also look at prevention, promotion, and treatment of mental health challenges. Next slide, please. And UNICEF, like all UN and other international NGOs and many local national NGOs, we operate underneath the guidelines of the Interagency Standing Committee for Mental Health and Psychosocial in Emergencies. This pyramid that you see on the slide, it represents the framework of mental health and psychosocial support services that are required to address the needs of individuals, families, and communities across all contexts, humanitarian, emergency, and that developmental nexus. Services should always and must be planned for and delivered across all four of those layers. Next slide, please. So since 2020, UNICEF has accelerated its work on mental health, and we are proud to support a range of different mental health activities across 130 out of 190 countries and territories, including high-income countries, as well as much more extensively in low and middle-income countries. Through UNICEF's multi-sectorial mental health and psychosocial support response, we've been able to reach over 38.9 million children, adolescents, and caregivers in 2023. Through child protection, education, health, community entry points, which operates bridging that humanitarian development nexus. Some of the examples of the work that we provide are around global mental health information, communications and awareness-raising activities, which including trying to break down stigma and supporting positive mental health messaging for parents and their children, as well as helping advocate for policies at the national level to promote child mental health. We support partners at the community level to strengthen service delivery and care systems across both the promotion and prevention in mental health, including in primary health care, education, and emergency settings. And we generate evidence and research for child, adolescent and caregiver mental health and psychosocial wellbeing, so we can really speak to the impact and the need. Next slide, please. Effective mental health and psychosocial support interventions work to reduce the risks and advocate for protective environments and access to services. This slide here is trying to capture for us that life course perspective across ages, where UNICEF, in collaboration with other partners, are looking at what kind of supports and services and activities can basically support child and adolescent mental health across that age range. We look to provide safety, stability, and nurturing environments. So a number of those different resources or tools provide support to parents and caregivers and teachers that focus on their own individual needs, their coping skills, and recovery, so that they are in a place of strength and skill and resilience to be able to then look after children from a nurturing care perspective. We aim to provide all of our activities and strategies and approaches that they are accessible within any community, that they are free or affordable, and they are rooted in community-led action and response at the district and sub-district levels. So this includes both community-based approaches and community-led initiatives and services for mental health and psychosocial support. So really having that voice of the child, the youth, or the caregiver from the design process all the way through to service delivery is key and a pillar for UNICEF's work. Next slide, please, Papa. If we turn now just very briefly to look at and think more closely about mental health and psychosocial support for children in more complex humanitarian emergencies, what would this actually look like? Next slide, please. Today, unfortunately, and very sadly, children and young people are facing unparalleled levels of vulnerability. Globally, over 200 million children live in areas affected by armed conflict, while more than 30 million have been forcibly displaced. These children are at heightened risk of experiencing mental health issues, with the lack of stability and exposure to violence leading to severe psychological distress that can manifest in long-term mental health conditions if left untreated and unsupported. And I'm sure many of you are aware of those consequences. Next slide, please. Violent conflicts cause widespread suffering, affecting the mental health and psychosocial well-being of children and families. Affected populations experience a range of shocks and stresses that can have both immediate and long-term consequences. 1 in 5 people in conflict-affected settings will develop a mental disorder if left untreated and unsupported. In such situations, mental health and psychosocial activities include any support that people receive to protect and promote their well-being and prevent and treat mental health conditions. Mental health and psychosocial support has to be, as I've already underlined, multi-sectorial, and the activities are implemented across many different technical areas. Child protection, gender-based violence, education, health, nutrition, and early childhood development programming are all key entry points, particularly when we're thinking about an emergency context. The workforce needs to be expanded, and each entry point needs to have their skills and their awareness so that they are in a safe space to be able to support the communities that they serve. Next slide, please. But what's the glue or the structure that can hold these emergency responses together across different sectors, where we all have different frameworks, different ways of operating? So again, if we go back to the Interagency Standing Committee, they've launched a mental health and psychosocial support minimum service package. Doesn't really trip off the tongue, I know. So the minimum service package is a tool that can be used to address the mental health needs of any given population affected by a humanitarian crisis. The minimum service package helps all stakeholders to coordinate their mental health responses within and across those sectors, helping them to come together to address the gaps, advocate for the needs, and plan and implement activities effectively. This minimum service package includes high priority mental health and psychosocial activities that can be implemented across the various sectors to ensure that the diverse mental health needs of any given population affected by emergencies are addressed immediately and through a sustainable lens. Next slide, please. So what does this might look like? I thought I'd try and give you some concrete examples from UNICEF's work. I wanted to take a case example from Ukraine, where they have successfully, since the most recent escalation in the conflict about 2 years ago, they've been integrating various initiatives tailored to the different age groups and the different contexts. So, for example, from a caregiver and family perspective, they have been sharing targeted support messages that enhance the ability to promote positive mental health for the caregivers when they're struggling themselves, allowing them a moment to pause and breathe and have space for themselves so that they are more able to nurture then their own children and families' mental health. For children and adolescents, it's looked like training on peer-to-peer psychological first aid, using evidence-based toolkits for adolescents so that they too can turn to their peer group, their friends to support them in times of need. And mental health and psychosocial interventions have been tailored to address the various mental health needs among children, including younger children, accessing education settings, reception settings when they've been on the move and fleeing from their own hometowns, and on digital platforms, which is really key when you have a highly mobile, refugee displaced context. And I'll speak to the digital platforms a little later on in our time together. And then finally, we can't ever forget the importance of the workforce. Continuing sustained training, support, supervision, supporting their own well-being and mental health, continuing capacity building for these professionals and paraprofessionals as they continue to provide quality mental health and psychosocial support to the community. Next slide, please. And then a different way to think about this is when we have increasing needs globally in terms of mental health and psychosocial support, how does UNICEF actually scale up and scale deep? Next slide, please, Papa. For UNICEF and many agencies, scaling up means increasing our reach. So how can we adequately expand our mental health and psychosocial coverage to serve larger populations in differing geographical areas? And importantly, really ensuring accessibility, equity, and sustainability of those services and activities when they're up and running. And scaling deep for us means impactful change, ensuring quality of services. That looks at changing significantly attitudes, values, norms, the pathways, the referral systems, and policies related to mental health in different governments. Important for cultural relevance and stigma reduction, looking at how can you bring those multi-sectorial and systemic changes together, and again, looking for long-term impact. Next slide, please, Papa. But there are, unfortunately, and quite obviously, a number of treatment gaps and barriers that hinder the way forward for us. There's limited access to services, the shortage of mental health professionals like yourselves who are working in humanitarian and emergency contexts and broader than that. And there are cultural and linguistic barriers in many of the communities that we work in. And it's important here, I think, to emphasize as well that that's including and not separate to the fact that we all need to continue to be mindfully decolonizing how we think about mental health services, how we think about mental health approaches, the terms we use and the structures that we place in certain settings. And that really draws back to an earlier pillar of UNICEF's work, is that it needs to be community-based and community-led, regardless of the age group or the context, from design to service delivery, and then researching and evaluating the impact, for us to be decolonizing mental health services and truly making them engaging and what communities need and want. We need to have that dialogue right from the beginning in terms of design and understanding need. And then globally, huge ongoing stigma and misconceptions around what actual mental health conditions are, what mental health needs are, and getting people to be open about looking for help, talking for help, and being signposted for help. Next slide, please. And then I'd lightly touched on digital space, which is an ever-growing area, and it falls within my remit within the global mental health team under mental health and innovation. So I wanted to talk us through very briefly a couple of examples where we've built upon decades of experience of in the field, face-to-face programming around mental health and psychosocial support. where our UNICEF regional office and country office colleagues have been designing, piloting and learning across a diverse portfolio of non-digital and then digital mental health projects to really see how can we expand that geographical reach, particularly thinking about those who are most vulnerable, potentially most disengaged, or geographically extremely difficult to actually physically get services to them. Next slide, please, Papa. So the first one I wanted to share with you is actually relatively quite old now, and it's UNICEF's earliest digital solution that's had successfully integrated mental health information and resources, and it's called UReport. So it's essentially a multifunctional digital platform that's user-friendly, cost-effective, and anonymous in terms of social messaging tool, and it's designed to empower young people. So those who have registered on UReport, known as UReporters, have access to information, can speak out on issues that affect them and their communities. It encourages citizen-led development and create positive behaviour changes. So UReport is currently active in 95 countries, benefiting over 27 million users who are all young people around the world. It was originally launched in Uganda in 2011. And it encourages safe participation through SMS and social media channels that young people are already using. So they're already active in those spaces, and we're trying to harness that and empower them further. It gives young people in their communities a voice on the issues that matter to them. And it also importantly allows UNICEF to collect data from their voices, which can be analysed in real time, really helping us to better understand what are the services and support that they need at a particular moment in a particular geographical area. Those real-time voices and that real-time analysis then informs our work, and it helps amplify our advocacy and inform our decision-making, as well as our advocacy work towards national governments and local governments. The information is also shared back to the UReporters to improve or save further young people's lives through accessing accurate, engaging content. So there may be an issue that comes up where we haven't got any information available on that. So we'll quickly develop and design information that answers the particular questions of the UReporters to support their needs. Another way that we've tried to expand access to this and support further is over the past 3 years, as part of the World Mental Health Day activities, we've created different mental health, very, very rudimental, but chatbots to help young people. So in last year's World Mental Health Day, we created a chatbot that was focusing on understanding your emotions and accepting how you feel, understanding how you can express how you feel in a safe way, and managing difficult feelings. And young people just have to send the word tips via SMS, and they receive the free mental health chatbot that flows through different information guided by questions. Next slide, please. If we then focus more towards our Latin America and Caribbean regional office, they've been focusing on leveraging a wide range of technologies like video games, chatbots as well, and AI under an umbrella term called New Tech for Mental Health and Psychosocial Support. The particular example I wanted to share with you here is called Podi Falar, and it's a virtual support channel for mental health and wellbeing for adolescents and young people aged between 13 to 24, co-designed by those young people, and was launched in Brazil in 2021. This initiative was born out of a partnership between UNICEF, civil society organisations, the young people themselves, through UReport originally, and companies with expertise in technology. It operates anonymously and free of charge, and through a chatbot named Ariel, and it was named by the young people on a survey where they basically chose which name they wanted, is accessed through the website or via WhatsApp. So again, it's thinking about where can we access and support young people with vital information at their fingertips. Next slide, please. I wanted to give you an example from Europe, and this particular one comes from Italy. Italy represents one of the first countries reached by many migrants and refugees in the attempt to arrive in Europe, and it includes large numbers of unaccompanied and separated children. Young migrant refugee girls and boys are constantly, unfortunately, exposed to violence, abuse and exploitation and human trafficking during their journeys. This obviously severely undermines their psychosocial well-being and impacts their mental health. In response to their mental health needs, Here For You was developed to increase mental health information and access to services to these unaccompanied asylum-seeking children and young migrants and refugees. It's across a range of different languages to really meet the needs of those young people. And it's a digital mental health solution that's embedded into the U-Report platform. So again, if they link on UNICEF's U-Report platform, they get the SMS messages and they can link into anything from reliable information around legal pathways to mental health and psychosocial support, information or counselling. It does so using very youth-friendly language, sensitive to gender, age and culture. And so again, it's another access that can be delivered remotely one-to-one, so very secure, confidential and anonymous. On the other side of this slide is a youth support platform, so slightly larger, that's being piloted and developed by our East and Central Asia Regional Office. And it's really aiming to build a bridge between existing mental health resources or services and connecting young people to them through digitising service delivery. So the approach is aiming to blend social media engagement, online counselling tools, combined with advocacy with government. So basically it would hopefully give them a menu of options and information and services that they can access at their fingertips. And essentially raising awareness of what's available for them when they need it. Next slide, please, Papa. And then one much closer to my heart, which I'm working on the global level, is our partnership with Spotify and UNICEF. Slightly different again. We've been working with Spotify since 2022 to support the mental health and well-being of young people and their caregivers. Through the Our Minds Matter, which has been co-created again with young people, the destination was launched on the Spotify platform, originally meeting the needs of Ukrainian young people and those in those neighbouring countries such as Poland, Czech Republic, who were feeling really impacted by the escalation in war 2 years ago. We have a range of different curated content on there, including music playlists that young people can listen to when they're feeling anxious to help them feel less anxious, if they can't sleep at night, if they need to study for their school exams or their schoolwork, as well as including a UNICEF podcast called On My Mind, which is based on our evidence-based, expert-informed and youth co-created content. As I said, it was already launched in Ukrainian and Polish and English in those neighbouring countries in June 2023. And we've since extended actually to 7 Spanish-speaking countries in Latin America and in Portuguese in Brazil in May of this year. And we will continue to look to see where need is and where we can work with existing youth networks to translate, adapt and really sensitise the materials to each new country and language and region. So as you can see, I hope UNICEF's beginning to be building up an exciting set of projects and partnerships over the past few years in a digital space. And I'd be really keen to hear your views and thoughts around digital space in terms of mental health service provision, but also how it supports us in terms of our own professional development, training, linking us to clinical supervisors, and particularly when we think about more low resource settings or where geographically it's particularly hard to reach our workforce when we want to support them. But one thing that's I would be mindful to kind of flag here is that throughout these design and piloting phases, we also appreciate as UNICEF the constant need to find appropriate balance and safety when incorporating digital solutions into any mental health ecosystem of service delivery. And noting that digital solutions must be only complementary to existing face-to-face services. For UNICEF, it's never going to be that digital spaces or digital solutions will overtake and replace face-to-face community-led services and support. Next slide, please. So a few of the considerations that we need to balance, a few of the different factors, in fact, is that the relationship between technology use and children's mental health and well-being is complex and it varies among individuals and contexts. So it's essential to avoid making sweeping generalizations and recognise the very different factors that contribute to mental health. Research quality matters, and not all of the research coming out in terms of digital space and mental health is of equal quality. So it's crucial to critically evaluate the methodology, the sample size of these studies, and really think about what is it that they're trying to to research, what is it they're trying to evaluate, and who actually has commissioned the piece of research in the first place. It may be a large platform such as Instagram and Facebook that have commissioned the research, which will have a very different aim or objective compared to potentially a research organisation. There are also many studies that suggest correlations between excessive screen time and mental health and well-being issues, such as increases in depression, anxiety. However, we would be mindful to say that correlations do not necessarily imply causation, and I'm sure you're all very well aware of that. So understanding the nuances of these relationships is essential. And then the impact of technology on mental health and well-being depends not only on the amount of time spent on that platform, that app, but also on the content and context of use. So educational or positively engaging mental health content can have remarkably different effects compared to maybe passive or negative content consumption. So I just wanted to share some of those particular points to you, and the need for kind of using digital tech to be able to signpost young people to referral mechanisms to service providers is incredibly important, and one that you can see that UNICEF is really trying to maximise and use, but mindfully. Next slide, please. And so, yeah, I kind of, well, I'm just going to check on the times, make sure I'm not overrunning. Digital mental health, you know, it really can be a good thing because it can improve access to mental health services, help detect mental health issues early, and really reduce the gap between demand and supply for mental health services. But as I've shared, it presents unique challenges. We're really careful to not forget good practice and the do no harm principles, particularly in humanitarian settings, for all of us as psychologists in any caring profession. But there's something here that we've learned internally, at least for UNICEF, you know, the approaches in clinical implementation of digital tools or interventions, it needs to be creative and it requires huge organisational change and shift. So not only for clinicians and service users, we need training. I needed training on these things to really understand the potential, but also the challenges with it, the minefields with it. But we also need more confident and skilled decision makers and policy makers, as well as those traditional roles. And clinicians such as ourselves, we need to really be working alongside digital navigators and non-clinicians who are delivering particular apps, and I'd love to hear from you. You know, to me, there's like 1,000,001 different apps out there trying to solve mental health and well-being, but how really well have they been vetted, researched, and who are the thinkers and the shapers behind the content that goes on many of those apps? I would dare to guess that they're not from a psychology or a mental health background, and that's incredibly harmful, or it has the potential for incredibly harm. So co-design and mental health needs assessments are non-negotiable among many other steps in this process of a digital space that's safe for all. And then my next slide, please, Papa. And finally, thinking about, obviously, the workforce. I've touched on it in a few different moments on the slides, but mental health professionals clearly play a key role in humanitarian service provision, but across high income, low income, middle income, providing support and care for people who have either experienced traumatic events, but also just everyday ongoing mental health needs and challenges. So it's now luckily and gratefully considered as an essential part of humanitarian health response. And that hasn't always been the case. I've been lucky enough to be in the humanitarian field for about 12 years now. And I was one of the very lone voices who was a trained psychologist, child psychologist in a couple of the different organizations I've worked for. And I was utterly astounded by the fact that there were many people working in mental health without that mental health background or even hands-on clinical service provision and kind of experience designing particular mental health and child protection activities in humanitarian settings. So just sharing that with you in a really open, transparent way, and happy to hear your thoughts on that if we have time. But there are a myriad of ways, and I hope you can recognise yourselves, if you wanted to, within these different areas of work that UNICEF provides. You know, there's everything from the essential providing clinical supervision and training to a wide range of mental health professionals, both professionals and paraprofessionals who are general health workers. They may be supporting in primary healthcare facilities, they may be supporting in educational settings, but they really are supporting sometimes very complex conditions. There's training non-specialists, as I just said, including community volunteers, social workers, on aspects where they can support community children and adolescents. And also thinking about, in a humanitarian setting, how do we engage with community, faith-based leaders? It goes back a little bit to me thinking about the decolonization of mental health, the terms we use, the interventions, the activities that we want to support. Ensuring quality of services provided, thinking about promoting dignity and opportunities for participation, and protecting people from violence and other human rights violations. Psychologists and psychology plays a pivotal role in strengthening social support and cohesion amongst many affected communities and families. So I do see our role as pivotal. And so I think one of the original questions when my supervisor, Zainab, and myself had early conversations with Papa and colleagues was around what is psychology's role in addressing global mental health challenges. I've already shared, I hope you can see yourselves in the various branches of psychology across these various approaches and strategies and activities that UNICEF and other agencies support globally. We have within our UNICEF global team at regional office and headquarters and country level a range of either clinical or educational psychologists, but we're also working in hand with child protection specialists, health specialists, tech specialists, innovation specialists, and many, many other technical areas. And only together in that multi-sectorial way, multidisciplinary way, will we be able to begin to truly address global mental health challenges. Thank you so much. And I'm very happy that I managed not to cough too much as well.
Whoops, hold on one. There we go. Thank you so much, Marcia. Thank you. To the group, the floor is yours. If anybody has questions, please feel free to raise your hand or just go ahead or put them in the chat if you'd rather. I think I see Alvaro.
I'm gonna yeah, here we go. Thank you, Marcia, for such a nice presentation and not just a very, very nice session, but also a very nice call to action. 'Cause I think it's very, very necessary to have people from that are in your position and organizations like yours to you know, lead and also give this overview of the current situation, right, of UNICEF. So my question is more of kind of asking you, how can alliances such as the GPA contribute to the whole overview that you are addressing, and then not just the alliance, but also the organizations that conform that alliance. And again, thank you very much for your time and for such a nice session.
Thank you so much. Papa, do you want me to, or Tini, do you want to answer one by one or wait and have a few, or I wasn't sure of the etiquette, sorry.
Oh, it's okay. I think if you answer Alvaro's and then we'll go to Jennifer.
Yeah, sure. Thank you, Alvaro. I'm so happy to hear that you enjoyed the presentation and that you found it useful. So thank you. I think there's something here, you know, that I was trying to get across in the presentation, that it's never going to be one organization alone or one individual. It really does require, you know, a different set of approaches, different sets of expertise at that national level. Now that could be at district level, sub-district level, or at a country level, regional level, and then kind of, you know, broader globally. And I see an organization such as this has that global reach and a set of different you know, I'm assuming many of you come from different branches of psychology, different countries, different regions. So it's really bringing together that set of expertise and learning on the ground kind of maybe what projects, what activities are happening if you wanted to get involved kind of at a country-wide level or even a more local level, thinking about where you can tap into there. There's always opportunities as well, you know, to reach out if UNICEF is working within your country or through a partner agency, thinking about, is there something there that you could link with? We're open to always forming partnerships and opportunities. That's the only way that UNICEF operates, only through partnerships at that local level. It's never going to be a top-down driven process. The part that UNICEF is, the only thing I would say that UNICEF, not the only thing, that sounds wrong, but one of the unique factors that UNICEF brings is that we have a mandate with governments, so that we can really have that advocacy and policy conversation either behind closed doors or in open forums, and really continue to kind of request and demand for higher financing, for higher response, for more service provision, work staff, shortages continue, but I think kind of like an organization like yourselves can join forums such as that at that global level, but also at the regional and local levels, to support and continue raising awareness and sharing those advocacy messages. More voices will always be the thing that stops people and hopefully ensues change. I hope that answers you. But we can also stay in touch and can give you more ideas and thoughts depending on where you're based. Thank you.
Thank you.
Thank you. Jennifer.
Yeah, thank you so much for this presentation. It was really informative and, just helped me understand, because you always hear about UNICEF, right? And so like there are so many different tools and resources that I just didn't know existed. So that was really, really helpful. I was curious from like a clinical standpoint about, because in my mind, I'm like, okay, how can I apply some of these things to my own practice, or kind of take some of these things back to my team here if they would be interested in learning more. And that Spotify for UNICEF sounds really, really cool. I recognize that it was originally created to address the needs of children's mental health in Ukraine. For that one, and maybe even the others, is it translatable to different populations? Like, is it more of a universal tool, or is it kind of Ukraine specific? I'm just curious of what tools I could potentially bring back to the community that I work in.
Yeah, great question, Jennifer, and thank you again for your kind words. I'm really happy to hear that you enjoyed it. Essentially, yeah, all of the tools are freely available, whether it's around supporting staff training or ideas around activities within a community centre or an educational space. All of UNICEF's resources are freely available, downloadable. It's basically, an open source with no fee, etc. So to be able to adapt that and use those with a Creative Commons license. So if you had particular things in mind, or go and search and kind of like, we can share some resources, and we'll share the slides anyway, I think, after this. So dig in deep on that particular slide where it has the different resources down the side of it, and age ranges. But in terms of if we use the Spotify as an example, yeah, absolutely. Yes, we designed it with Ukraine and conflict in mind to begin with, but we actually built it out a number of the episodes, and definitely the second season of On My Mind, the podcast, to be evergreen content, as it were, and actually so that it would be hopefully applicable to any young person between the age of 16 and 25, maybe a little bit younger, a little bit older, but essentially 16 to 25. So that if they're struggling, and it's the main everyday things that people struggle with, that we heard young people ask about. So depression, anxiety, how to ask for support, how to talk to friends and family when you're struggling, or who to talk to if you don't want to talk to your friends and family. So the content's there. The podcast, the broader hub of Our Minds Matter is only open in the languages. So it's only open in Latin America and Ukraine and Poland, but the On My Mind podcast is freely searchable on Spotify platform anywhere in the world. There's no adverts in it. Part of the contingencies on UNICEF side was, even if you have a free membership on Spotify, you normally get adverts during your playlists or whatever. There's no adverts through the podcast, because we are mindful that we don't want to be promoting anything to young people while they're listening, particularly not when they're looking for mental health support. So feel free to use those and engage with those further. And we launched this World Mental Health Day, actually, the podcast, through our national committees for UNICEF in New Zealand, US, Luxembourg, and a few more that I'm not going to be able to remember now, but a wide range of the English version that they felt they could kind of work with and kind of cascade out through their different services. So yeah, please look it up or get in touch if you need more information. Thank you.
Thank you.
Any more questions?
One question.
Wendy.
Today you spoke about so many different digital platforms. You report Podfiller, Here for You, and you can see Spotify with this thing now. We say, is it good? There must be balance and safety. Good practice, do no harm. But do you know, the other day I heard about chatbot that for me, somebody sent me an article, and I think a child suicided because of that, because he was prone to isolation. So he resorted to using the chat bot. What is the best way that we could go through this? Do we have talks with the schools, the parents, the communities? How do we save, because this is open for young people. How do I begin? Do I begin in my home with my 8-year-old grandson who is exposed to all of this control? I said, I see you listening to TikTok and I don't like the language. He said, but you say language, but I can spell them for you. How do we control that as parents? What is the best way? As the psychologist, you said the role, what is our role in all of this? Because there's something new occurring every single time. Today, I learned something about all those different digital platforms. Oh God. So what is our best bet to save the children? How are we doing it? So everybody should be in it. The school, the parents, the communities, but there they are under the blanket looking at pornography, Yeah. I find it a little frightening. It's good to have all these digital platforms, but it's a little bit frightening, How do we, what level of control do we use? Which is the best way?
I
don't
hear
know.
you, Wendy. I hear you. And even though my portfolio for UNICEF is innovation, which includes digital, I'm honestly also baffled by the number of different apps coming out, not from UNICEF, but like externally, in the world out there.
Yeah.
I think there's a couple of different layers here, and it might not feel like an adequate answer, but let me try to go through briefly. Really important question. I think there's for UNICEF at least, we have a parenting hub online where we try to give guidance exactly as you just spoke to, Wendy, around as a parent or as a caregiver, what are the boundaries that we can put in place within our own home, including our own usage. So, you can't sit at the dinner table telling your kid not to use the phone if you're using it yourself, obvious things like that. So kind of we try and put out information on our parenting hub across different countries around suggestions of like how you can have a positive conversation around internet uses and the harms, or what platforms you're on. So parenting advice is one step. Then yes, absolutely. Then the advice in terms of schools, educators, spaces where children and young people are accessing and maybe using their phones, etc., educating, sanitizing that information in those spaces.
Right.
The higher levels, if we go to the other end, maybe, is UNICEF and other agencies using our platforms, which we do at global events with those platform providers. So whether it's Facebook, well, Meta, I guess I should say, Twitter, talking to them and really spearheading difficult conversations around previously the lack of control and guidance and parameters that they had on their platforms. And slowly, some of those platforms, not all, are beginning to put more boundaries around usage. And, under the age of 13, you can't have an account, etc., etc.
Right.
So they're continuing to advocate at that level and to try to, and this isn't meant as a disrespectful way of phrasing it, but trying to educate national governments as well about what policies need to be put in place within each country, because there's some legal jurisdiction there as well in terms of what's allowed on platforms and what's not. So there's different layers in that. And one thing that UNICEF at least is trying to get up off the ground is, and it may not be successful, it's an idea that we're willing to try is that UNICEF sets up like a vetting criteria of assessing external apps under UNICEF's kind of framework of guidance, do no harm, etc., etc.
Right.
And kind of having like a catalogue of like, well, these have been vetted and verified by UNICEF. So if you're a parent or if you're a young person, you know that these are going to be the safe ones that you should go to, because there's a lot of different apps out there for many different objectives. Much of them are for monetary and advertising revenue. And so those aren't going to be the ones that are predominantly focused on supporting mental health and well-being. And so how do we cut a clear line so that as audiences, we understand which ones are the helpful and safe ones versus the ones which we really shouldn't be using or advocating for other people to use. But it's baffling. I hear you. And it's changing every day. So I'm just trying to keep up myself.
Thank you very much.
Thank you for the question, Wendy.
Oh,
Well, on that note, I'm looking at the time and we're just past the hour. I just wanted to ask one last time if there are any more questions for Marcia before we close. If not, I'd like to thank you, Marcia, for a fantastic presentation. It was really, really great. We learned a lot. I'm so glad that you were able to step in for Zainab. At the last minute, you did an amazing job and we're just really appreciative. And thank you to the group for your time as well today.
It was an amazing opportunity. I really enjoyed talking to you. And if people have, Papa, you've got the slides, so please feel free to share those to colleagues. And if people have questions, please don't hesitate to reach out. That's fine. Yeah. Okay,
great. Thank you so much, everybody. And thank you again, Marcia.
Thank you.
Take care.
Thank you, Tierney. Take care. Have a great day, everyone. Bye.
Thank you. Bye-bye.
Bye.
Bye.